it then.
Okay, and good evening, everyone. Today we have the special pleasure of hosting Dr. Sylvanus Effiom. This is his second webinar with us and the continuation of his first webinar, which is available for viewing on our YouTube channel. So after this, if you would like to be oriented with the lecture material from the previous webinar, please hop onto our YouTube channel. But a bit about Dr. Effiom's academic history. So he holds a PhD in Equality and Discrimination Law from Middlesex University, and a Master's of Law in International and Comparative Banking Law from the London Guildhall University. So today, a little bit about our webinar. For today's webinar, Dr. Effiom will provide an overview and contextualize disability discrimination, data, and policy. This is intended to strengthen the capacity of researchers who are working to advance disability equity in an organizational setting. So he will explore what data tells us about disability equality in employment, alongside the business case, which tackles the economic and human rights dimension. And he will do this by reviewing legal and policy frameworks to combat discrimination, core principles, and effective change strategies, together with ways for disability inclusion in an organizational culture. So this will be an opportunity to learn more about organizational policies and logics of disability. So we will hold questions and comments for the very end of the presentation. And during our discussion slide, we will open the Zoom floor for audience members, at which point Dr. Effiom and myself and Dr. Coburn will be able to facilitate your questions or comments as best as possible. At that time, please feel free to unmute yourself, leave a comment in the chat box, or use the hands raised function on Zoom. And me and Dr. Coburn will read the chat comments so that everyone in the Zoom audience can hear. And I will now pass the microphone to Dr. Effiom, who will begin his presentation. So
Sarah, I'm just going to interrupt for a minute. Sorry. Sorry to interrupt. Can you turn on the live transcript, please?
Yes, absolutely.
Thank you.
And I will do that. And I just want to say thank you, everyone, and please enjoy.
Thank you, Susan, for the kind words of introduction. And thank you everyone for taking time off your busy schedules to be here today, to listen and participate to this presentation on the legal and policy perspectives of advancing equality for persons with disabilities in employment and service delivery. This session, as Susan said, is a follow-up to the previous earlier one we had in March. The first session in March was focused mainly on exploring the legal framework for combating discrimination in employment and service delivery. And in that presentation, we looked at the various legislations on anti-discrimination legislations and the definition of discrimination using the UK example. We established that there were four, there is no one single definition of discrimination. Discrimination is defined in different terms and contexts. In the case of the UK, we have four different definitions of discrimination. You have the direct discrimination, which, as I said, had to do with less favorable treatment. We have indirect discrimination, which has to do with the policies, practices, and criterion of an organization that impacts desperately on a particular group of persons, and therefore creates the disadvantage. We also have the disability-related discrimination, which is defined in terms of unfavorable treatment. And the last but not the least is that of the duty to make reasonable adjustment, which we did tie it up closely with the provisions of the CRPD, the UN Convention on Persons with Disabilities, to highlight the particular relevance of this form of discrimination to persons with disabilities. Tonight, what the focus would be is on the policy dimension. So we'll be looking at the type of policies and which organizations, employers develop to advance equality and inclusion for persons with disabilities, and also be able to explore some of the strategies which could enhance the abilities of researchers working on advancing disability, equality and inclusion within the workplace context. So that, briefly, that is the context in which this particular presentation is going to take place. But I think before I can proceed with the presentation, there are some few points I felt I should highlight, probably because it will help us understand clearly the interplay between the anti-discrimination legislations and the policies, organizational policies intended to embed equality and inclusion for persons with disabilities. The first point I think I should mention is the fact that most, if not all, anti-discrimination laws are, they simply tell us what not to do and did not tell us what to do. In the legal terminology, you'll be talking here of negative compliance. So these laws tend to define conduct which we should not do and do not tell us what positive actions we should take to promote equality and inclusion. The second thing which we have to bear in mind when looking at organizational policies in the context of the legal framework is that of the fact that anti-discrimination legislations or laws tend to provide for the minimum standards. So, and that is very important for researchers to be aware of, because there could be a possibility that organizations would prefer to focus on respecting the provisions of the law in terms of providing a minimum standards rather than proactively advancing equality and inclusion for persons with disabilities. So when researchers are looking at organizational policies, the starting point should not necessarily be the legal compliance dimension, but they should be looking at how organizations are proactively and positively providing substantive equality for this group of persons. So those 2 points made, we can now proceed to look at some of the issues that arise within the context, as I said, of the policy dimension of organizational policies and practices to advance equality and inclusion for persons with disabilities. I think the first and the starting point in that respect is to consider the culture of the organization, that is the organizational culture. When we talk of organizational culture here, we are talking generally of the value system, the beliefs that drive the organizational, the working of the organization. We all, why is culture very important in this context of advancing equality and inclusion? Primarily because culture generally defines the mindset of the organization. As one also said, is the blood wire of the organization. So to be able to understand to what extent an organization is engaged in promoting or advancing equality issues, one should be able to first of all look at the culture of the organization to be able to, as I said, establish how this, the values clearly of that organization. If we talking in the context of culture, there are two things which are important here. First, there are two types of cultures which operate within an organization. The first is that of what will be considered as a visible culture. So when you look at organizations, what you see are the policies, the policies, what they have on their website, their guidance, rules. Those are things which artifacts and which are visible to the public generally. This particular aspect of the organizational culture is what organizations generally want the outside world to see and appreciate their actions within that context. Now, the downside with this visible culture, which, as I said, are manifested in the policies, the guidances of the organization, is that more often than not, these policies and guidances, operational guidances, and other rules within the organization, written rules within the organization, are crafted in a way has to comply with the anti-discrimination legislation. So there is a potential there of us, saying the manifestation of what I said earlier about negative compliance. So organizations would generally want to respect the minimum standards as prescribed by the law, especially those who have litigation aversion. So that keeps them within the boundaries of the law. But as I mentioned earlier, this does not necessarily provide for advancement of equality and inclusion in the context of the substantive equality we are talking about here. So that is something we should take note of when looking at organizational culture. The other aspect of organizational culture is that of the invisible culture. Now, the invisible culture is the one that is most interesting in the context in which we are talking tonight. This is the part of the organizational practices, policy, actions that are not easily perceived by the outside world. So they are embedded in the processes and systems of the organization, the daily workings of the organization. And because they are not easily perceived by the outside world, there is a potential that they are not subjected to adequate scrutiny to see how they could operate to disadvantage particular groups of persons within the organization. So when researchers are looking at organizational culture, they should keep a particular eye on this dimension, on this particular aspect of the culture, the invisible culture. We probably must have come across in our workings or in our readings concepts as micro inequities and subtle discrimination. These are terminologies that are closely tied to the invisible culture. As the term implies, subtle discrimination is the type of discrimination that is not very visible in terms of its viciousness, but it refers generally to how individuals are treated, ignored, sidelined, and made generally invisible by the organizational culture. So when we when we conduct research within an organization again, we should keep a keen eye on this issue of the micro inequities that are generated as a result of this subtle discrimination that pervades most organizations. That said, I think that gives us a general idea of how the cultures, organizational cultures, interplay with the notion of anti-discrimination legislations and prescriptions. But the issue here is what are the instruments, what are the principles that researchers who are interested in advancing disability discrimination within the equality and inclusion within the workplace should focus on. I have identified in the presentation some few what I would call fundamental principles which could be employed to affect any change strategy by researchers on disability discrimination. As I said, the first, I looked principally, and this is something which is not born out of just academic literature, but it also has a bearing on personal experience and how organizations work. The first major point I want to mention here is that of staff networks. Now, when the staff networks have in other jurisdictions, particularly in the United States, they will generally talk of staff affinity groups. In the UK, we talk of networks, staff networks. Now, these are groups of persons. In the context of disability, a staff network will refer to a group of, a network of staff with disabilities who come together to discuss and, provide support to each other within an organization. Most organizations are now are saying the staff networks has very important players within the equality and inclusion agenda. And therefore it is something which is, as I said, is having increasing importance and needs to be looked at critically in terms of the role it plays. Now, these staff, why are staff networks important in this context? First, when you look at disability equality issues, I think most researchers will agree that the appropriate starting point for any research on disability will be the collection of data on the experience of the persons or the workers with disabilities and how this experience is impacted on by the culture of the organization. And the staff networks provide a very viable platform for understanding this experience of persons with disabilities within the organization. So a researcher who is able to ally with this or link up with the staff networks will be able to not only source viable, important knowledge on the workings of the organizations in the context of disability, but is likely to obtain valuable intelligence and data that could help advance particular research the individual is taking, is conducting within the organization. From experience, the staff networks operate In my organization, I do chair the Disability Staff Network, and it's, as I said, a very reliable platform to obtain not only knowledge, but also, sorry about this, to get valuable intelligence about the organization. One of the major challenges which any researcher will encounter within an organization is, and this is tied with the concept of having a staff network, is the fact that most persons with disabilities, the disclosure rate, put it this way, of the disability of staff are not very reliable. So if you go by the data, the available data within organizations, you are likely to find that in most cases, the disclosure rate just ranges between 1 and 1.5% of the persons who are disabled within the organization. And this could pose a problem to any researcher, because you will be probably dealing here with a situation where the number of persons who are declared disabled within the organization do not reflect the exact number that are really operating with the organization. And many reasons have been advanced to explain why this low level of staff reporting on disability. Obviously, this is not the forum to explore at length some of these reasons, but I'll just mention a few. We know that disclosure hesitancy may be due to the fear of stigma, but also within the context of the relationship between the law and policy, there is a defect which may explain to an extent why it is difficult to capture the real data. And that is because if you go by the legal, most persons who have a disability or a long-term health condition may not consider themselves as disabled if you go by the legal definition of disability. And as I mentioned in the part 1 of this presentation, the definition of disability within anti-discrimination law could have a limiting effect in terms of who qualifies as a disabled person. And that limitation could provide a reason why many people with long-term health condition may not necessarily consider themselves as disabled, and therefore are not likely to declare their disability status within the organization. The second reason, which again, I felt is important, is the fact that there is no legal obligation on a disabled person to declare their disability. So generally, and when I say generally, there are certain exceptions, the law does not oblige an applicant or a worker to disclose their disability to the employer, either at the stage of application or when they are already in employment. The reasoning behind this is that is to prevent employers using the disability of the worker or the applicant to disadvantage them in the process of employment. But the downside of that is that the staff with a disability may not be able to access the relevant support if the disability is not known. So even within the context of the law, and when I talk of the law, I'm referring here primarily to the Equality Act 2010, the UK Equality Act 2010. The law provides section 66 of the Act provides certain instances when an employer may ask of the disability of the staff or the applicant for employment. Top in the list is when the employer wants either to undertake a positive action, i.e., in terms of making available training facilities to the employees, or for monitoring equality and diversity monitoring purpose, or to provide reasonable adjustment to the staff with a disability. So beyond those identified circumstances within the Act, there is a general prohibition on the asking about the disability of a person with the disability of a staff as such, or an applicant to a job. Now, there we can see how the whole idea of the staff network will enable any individual or to get that information and to be able to tap into the experience of members of this staff network. Another thing which I think we should bear in mind when looking at how staff networks operate is the fact that these staff networks are not only limited, membership are not often limited only to those who are disabled, staff who are disabled, but at times include what is generally called allies. So these allies are persons who are members of the staff network, but they do not necessarily have a disability. They may be individuals who have had a disability, a relationship with a disabled person in one way, either in a family context or just generally are passionate about advancing equality and inclusion for persons with disabilities. And the important thing when it comes to allies is that these individuals, being persons without disabilities, provide a very appropriate vehicle for champions of disability to put through their message. I have often argued that within the organizational context, the disabled staff does not need to be converted. It is the person without disability that needs to be converted in the context of disability equality. So getting these individuals as allies into the staff network will prove a very important tool to advance whatever cause we're pursuing in terms of inclusion for persons with disabilities. Again, it is generally said, and this is somehow tied to the other point I'll be making about emotional intelligence. When it comes to issues of decisions on equality, and particularly with persons with disabilities, it is often, individuals often react based on emotions rather than reason. So if we can get these non-disabled individuals who demonstrate this emotional attachment to disability issues, then that will be making a very positive inroad into advancing the cause for disabled staff or workers within an organization. Related to this idea of the staff networks or affinity groups is that of disability champions. Again, the reason why I thought the disability champion should be mentioned here is because when we talk of organizations, we know how the modern organization is structured, very decentered. There are many different centers of power within an organization. So it is not just one whole unit. Because of the dispersed nature, it is very, very difficult to understand what is happening in the various departments. So you need individuals within these departments who are like foot soldiers. They can gather intelligence. They can give you first-hand information on what is happening within the context, within the particular department. Again, this is very important when you realize what I said earlier, that most organizations, if you look at their policies, they do not necessarily reflect what is happening in the ground. So you need individuals, these disability champions, to be able to feed back intelligence on what really is taking place. And that, again, is something, as I said, which needs to be taken into consideration. The other thing which I thought we should look at quickly is that of emotional intelligence. Now, I mentioned earlier that when it comes to issues around equality and how organizations implement or not implement policies, at times, it is often driven by reason. People come in, and by emotions. People come in with their different emotional attachment to the issue of equality, advancing equality for especially in the context of disability. Now, how I mentioned in the presentation, you could see I've identified emotional intelligence broadly in the context of awareness, right? And awareness there, I mentioned 3 different dimensions of awareness. Awareness of the self, the individual, awareness of the other person that you're dealing with, and awareness of the organization. These 3 dimensions of awareness, they do interrelate, and they are very, very crucial in any strategy to advance equality issues. As I said, research have demonstrated that organizations, they talk, but don't necessarily put into practice what is being portrayed in their policies and organizational websites. So to be able to get management to buy into equality issues, and particularly for persons with disabilities, which we acknowledged earlier in the first part of this presentation, that one of the reasons why disabled people are not found, do not really get into employment, is because employers generally do not consider them as being economically profitable. So if you have to get management to invest into disability equality or inclusion, then you will need some degree of emotional intelligence and not just preach the legal, remind them of their legal obligations. It is that dimension of emotional intelligence, which is basically about building trust and understanding, the emotions of how our emotions interplay with our reasons when it comes to decision making. That could be crucial than trying to enforce the anti-discrimination laws on these organizations. So that said, I think the last point which I'll just emphasize when it comes to these strategies is that of collaboration and partnership and collaboration. The points I wish to emphasize here is the fact that as researchers, we cannot operate, in silo. We need to collaborate with other organizations outside the particular organization we are researching on, to be able to get valuable intelligence and understand what is happening outside in terms of good practices. And that could provide, as we'll see later, an important benchmark by which we can measure what is happening within the organization we are researching on. Again, the issue of collaboration and partnership has an important underpinning with the disability mantra, which talks of nothing for us without us. The staff network, as I said earlier, provides that form of collaboration internally, but externally, we need to engage with the wider community, other stakeholders, to be able to build a solid foundation for any strategy to promote or advance the cause of disability, equality, and inclusion. So that said, I think we can now conveniently proceed to consider the issues of how we can measure some of the work we do, or what an organization particularly is doing in terms of the equality for persons with disabilities or workers with disabilities. With regards to benchmarking and measuring progress, now, again, we need to remind ourselves, this should be a permanent reminder that organizations generally have an array of policies and strategies which they tend to implement at various times to achieve or embed equality and into their system of processes, or into the culture of the organization. Now, it is not what should be interesting. What should interest a researcher is which of these different policies are working, and if they're not working, why are they not working? So that is why I thought it would be important that we look at taking the example of the NHS in the UK, how we've been able to, the framework for benchmarking and measuring progress. And this, again, we'll be looking at particularly the health sector, how it operates within the National Health Services. Now, you could look at different frameworks for benchmarking. First, I looked at the external frameworks, though not exhaustive, but this could be very, very helpful. And I also looked at some of the internal frameworks or instruments that are available, which we could use to measure the progress. The first, as I said, the external framework. Now, within the NHS in the UK, NHS organization providers, health providers, have there are regulatory frameworks which have been put in place to ensure that organizations providing health care are able to think proactively and have the support to implement policies that could advance equality of opportunity for different equality groups, not just for persons with disabilities. But in the specific case of disability, we have three major instruments which I'll talk briefly on. The first is that of what they call the NHS Workforce Race Equality Standard. The acronym is WRES, W-R-E-S. Now, the standard came into force in 2018, and provides, is primarily intended to provide a framework for organizations, health providers, to be able to measure their policies and practices on disability in relation to persons who are not disabled, workers who are not disabled. The standard has 10 metrics ranging from issues around the difference between clinical and non-clinical staff, the employment of clinical and non-clinical staff, right? Includes issues around performance, competence, and engagement of staff with disabilities. One of the most important aspects of the REST metrics is the recognition within that context of the operations of staff networks. So there is, technically speaking, an obligation, what you say is a contractual obligation between the NHS and the providers of health services to ensure that there is a proactive engagement with staff with disabilities in the formulation or the design, formulation, implementation, and evaluation of policies. The intention there, again, is to ensure that these policies, disability-friendly policies, are embedded into the policies of organizations right from the start, and not as an afterthought after the policies have been developed. So the rest comes with certain reporting obligations on a yearly basis. Organizations are supposed to provide data on the various metrics. And again, another aspect of the metrics which one has to look at critically is that of the notion of presenteeism. This is a situation which is becoming increasingly prevalent in organizations where individuals with disabilities, not just in terms of the legal definition of disability, but also individuals with long-term or health condition, that tends to impair their ability to perform their contractual functions. But what happens is, because organizations do not have flexible policies when it comes to sickness and disability, these individuals are forced to come to work, but their performance while at work is far below the expected level. So the concept of presenteeism is very, very crucial in understanding, again, how disability could and policy, organizational policies interplay in certain instances to disadvantage not just the individual worker, but the organization as a whole in terms of the productivity. The second framework which I thought would be important to mention here is that of the Accessible Information Standard. Now, this particular regulation was brought into force in 2016, and it has to do primarily with persons with disabilities. It reflects the spirit of the Equality Act, as I mentioned earlier in the first presentation. Section 20 of the Equality Act deals with, provides for 3 different levels of reasonable adjustment, which employers or organizations are expected to make in relation to disability. And one of it is that of the provision of auxiliary aid. That concept of the provision of auxiliary aid covers issues around the type of format, communication format. So this particular standard, the Accessible Information Standard, was intended again to provide a framework for organizations to be able to meet the specific communication needs of certain individuals. And it applies mostly within the context of patients. But this, the activities or implementing the standard could obviously have a rippling effect on how staff with disabilities are treated in terms of their communication and needs. The ACE, that is the Accessible Information Standard, has 4 major requirements. As I said earlier, it deals, intended to deal with how organizations, health providers operate in relation to patients. So when a patient comes, the organization is required to do 4 things. First, to ascertain whether the particular patient has a communication need. The second is if there is a need, that need has to be recorded. So if, for instance, a visually impaired person prefers to be communicated via email, that particular need has to be noted in an appropriate form. The third is the requirement to flag up that communication need. When they talk of flagging here is a bit different from recording. What the law or that particular regulation is looking at is make the need permanently known to other staff who access the medical records of that particular patient. Not only within the organization, but other health providers who may have access to that information, so that the needs of that particular patient is not only met by the one organization, but by all the other organizations that they interact with in the course of their medical lifespan. The last aspect is, again, very, very crucial. It has to do with imposes the obligation to meet the need. So it is not just flagging or recording or assessing whether the person has a need, but also meeting the need. Now, if you go back, remember I mentioned in the illegal, when the first part of this presentation, that a unique aspect of the English or the UK law on the Equality Act 2010 is the provision in section 149 of what is called the public sector equality duty. Now, that particular duty, as I mentioned, marked a major shift, conceptual shift from the individualized approach to anti-discrimination, which has traditionally characterized the conventional laws on anti-discrimination laws, to a much more proactive approach to equality. Now, the PSED, which is the public sector equality, imposes certain proactive duties on public authorities, employers, to take certain positive actions to ensure that the needs of specific groups of persons, which are different from the other groups. So in the context of disability, you're meeting the needs of the disabled person that arise from his or her disability that are different from those that are not, different from those of persons without disabilities. So you could see how the last aspect of the ACE ties with the conceptual framework of the PSED. And it is those linkages that needs to be, that should capture the attention of any researcher to be able to make that difference between what I called earlier negative compliance and taking positive action to ensure substantial or substantive equality for persons with disabilities in particular. So that is the second. The third framework, which again is important here, is that of what they called the Disability Confidence Scheme. This scheme was developed within the UK by the Department of Works and Pension. And again, it provides a framework for organizations to measure their progress on disabilities, on disability and how they treat disabled staff with disabilities. Most organizations, this particular framework replaced what used to be the two-tick policy within within the DWP, the Department of Works and Pension, and the uniqueness of the uniqueness of this particular provision or framework is the fact that organizations have they have the possibility of having continued support from the DWP itself in the implementation of the requirements of the framework. So the organizations can access continued information and guidances within their organization.
Dr. Effiom?
Yes.
Sorry to interrupt, but I promised that we would have time for discussion, and
yeah,
we are getting close to the end. So could I just ask you to wrap up in 1 minute so that we do have a few minutes for discussion, please?
Perfect. Okay, thanks a lot, Lynn. Finally, let me, the last thing I think I will just mention here is that apart from the external frameworks, we also have the internal frameworks within organizations, which we need to keep an eye on. Most organizations have what they call the electronic staff record, ERS, which could be accessed by researchers within the organization, and that would provide valuable data for whatever research we are conducting. Finally, I think we could see clearly that there is an important interrelationship between the legal prohibition of discrimination and the way organizations develop policies or develop and implement policies to enhance equality and inclusion for persons with disabilities. And it is this relationship which researchers should keep a critical eye on and be able to develop and expand on it to ensure substantive equality for persons with disabilities. Thank you very much. Hello, Lynn.
Yeah. Sarah?
Sorry, I was just
It's okay.
Anybody would like to ask Dr. Effiom a question or a comment, please unmute yourself or write in the chat box, or even use the hand raised function and we will call on you. So now would be the opportunity to ask your questions or comments. So please do.
Hi, can I talk, please?
Yes, absolutely.
Yeah, Dr. Effiom, I want to thank you very much for the very elaborate discussion. It was very interesting, and I must assure you that I've learned a lot. And it was great listening to you talk. I'm really impressed, and I have learned a lot. And when I go through the YouTube again, I think I'll raise I'll have other questions that I might probably get to you later. Thank you very much.
Thank you. Thank you.
Let me just jump in. Thank you so much, Dr. Effiom, for your presentation. And the last two presentations have been really good. I did ask some of my students to join. I hope they joined. We had a course on managing diversity and employment. So one of the key things that we were raising was this issue of competence. I know you have discussed it because at times there is advocacy for us to employ persons with disability. Yes, but at some point, we have a limitation in competence. I know there is limitation in the general population, but I want to know from you, what is your take on employment of persons with disability and competence? Because at times competence is lacking, accessibility issues at the level of the organizations, etc., etc. I don't know whether I missed out on this, but I just want to know what your take is.
Okay. Thanks for asking this question, because it's a very topical issue. Now, the first thing I'll say is it all depends on how you define competence. And there is something in the Equality Act, which is very, very crucial. There is a reference to the essential qualities of a job. In 2011, there was a case in the European Court of Human Rights brought by a citizen from Greece who was visually impaired and was refused from taking the entrance examination into a nursing course. And the court pointed out there that such a refusal amounted to an illegal restraint or prohibition of employment opportunity, because the nursing job is not all aspects of a nursing job that require sight. So it is incumbent on the employer, right, to be able to structure the essential qualities of a job in such a way as to take into account the limitation of the particular individual. So if employers come up with the way they define the requirements of a job, could in itself be very exclusionary. And it is these nuances in the way the HR or whatever department, employers generally perceive competence and merit that needs a bit of change. So when looking at the issue of competence, and again, I mentioned competence in relation to sick leave, right? Now there's what they call the performance interviews or appraisals within organizations. So organizations may, a person with disability may take maybe off work on several occasions because of issues related to that person's disability and not sick. Disability is not sickness. We have to make a difference. So if I have to take time off work because I have to attend to some aspect related to my disability, you cannot place me, or it will be wrong and unfair, of course, to discriminatory, so to say, to place me on irregular absences because of sickness, which most organizations do. The other thing I would like to mention in terms of the question you've asked is we have to make a distinction between entry into the employment and staying in the employment. It often arises in regards to the ability of the person with disability to get into employment. And that is where I fall back to the idea of let us look critically how organizations define the particular or essential qualities of a job, because they can deliberately, unwittingly skew that essential qualities as to keep out persons with disabilities. So I don't know if that explanation provides any help to you.
Thank you so much for Thank you so much for the elaborate response. It is very, very helpful. Organizations should know all competence, and they should also, there are times that organizations have very discriminatory policies. So we are thankful for this presentation. It tells us about what organizations should do, because they do the same for other people. Like if you are a secretary, you need a computer. So they provide a computer. If not, the secretary will not work. So it should go the same. Thank you so much for the...
I think just to reinforce what you've said, you know, I talked also about the requirement of structural, the requirement to make reasonable adjustment and accommodation. Now, in a place like Cameroon, you could use the CRPD. I made section 2 of the article 2 deals with issues around reasonable accommodation. You could use it, though it does not have direct application in domestic law. But I think employers will understand most of the discriminatory practices are not intentional. That is why indirect discrimination, the concept of indirect discrimination, section 19 of the Equality Act I mentioned, is very important. It is not about the overt practices of discrimination, but those discrimination that arise as a result of the practices and policies of our organization. These type of discrimination are not generally intentional. They are just out of practices which needs some sort of they become rusted, and organizations take it as normal until they are challenged.
Thank you, Dr. Effiom, for that. We just have a hand raised, and we have another question, I assume. After this particular question or comment, we will close the session. But I will ask Atel A14, who has his hand up, to please unmute yourself and ask your question or comment for Dr. Effiom. You can unmute yourself. Sorry.
Hello.
Hi.
Hello. Hi.
Would you like to ask your question or comment?
Go on the line.
Sorry?
I just want to make a comment on what Doctor has said. I'm saying I just want to make a comment on what Doctor has said.
Yeah, go ahead.
Yeah, I was just trying to add that people with visual impairment being nurses, for example, it would also be good so that they should not exclude people with disabilities from other jobs. They should not feel as if they cannot do it. And for example, like drugs, there are some drugs that when you go to the hospital, you see that they have written the drugs in Braille. That one with visual impairment can identify that this is the type of drug that he or she can prescribe to the patient. I think that one is really important. And if we can practice to get to that field, it will be very, very great. That's what I just want to say.
I think you're very right. And that is, I think, a very salient point you've made. In technological advances, there are a lot of things now that persons with disabilities would not have been considered capable of doing. But today, there is no reason why a disabled person, whether visually impaired or not, cannot do, anything in medicine. We've seen a lot of things being done in computing, and we are moving towards driverless cars. So a blind person should be able to drive a car in the future, isn't it? So if employers, if they are to employ a driver in the future, there is no reason to say to conduct eyesight tests when you don't need a driver to drive the car. Hello.
Hello. Yes, that's a very good point, Dr. Effiom. Thank you for your comment as well. And for everyone who's posted in the chat box, I'd also like to let you know, Dr. Effiom, that people have been messaging in the chat box saying thank you so much for your presentation. Lewis also mentioned, thank you so much, Dr. Effiom, very interesting presentation, as well as other people who've been attending. So now I'm going to wrap up the session and just close the session for now. And I would like to thank our wonderful speaker, Dr. Effiom, for reviewing all the important legal and policy aspects of discrimination and the strategic and implementable ways for moving forward. And that's such an important integral work that's needed in organizations. We really appreciate your time and your tremendous knowledge and research that you've gathered in order to share with us the ways for improving our organization and really society as a whole. So thank you so much, Dr. Effiom, for your brilliant contributions with us today and in your everyday work. And for everyone joining us, thank you for taking the time to be with us today. We really hope you've been enjoying the webinar series, including today and part 1 session. Our next webinar will be on a panel discussion on women with disabilities. So please keep a pin ready for that. And also remember that our webinars are now viewable on YouTube, as well as Dr. Effiom's part 1 presentation, and part 2 will soon be up. I will now close the webinar, and again, thanking our speaker for his excellent presentation. If you have any last comments, please unmute yourself, but all the very best to you, and goodbye for now.
Thank you. Thanks, everyone. Bye.
Thank you, Doctor.